You're now locked onto the Pulse Radio Show with Marcus Myers, X-Tina, and Ken Pyle. And on the 1 and 2s, Big Red the DJ. It's the Pulse Radio Show, baby. Believe that.
Where he doesn't talk the talk,
he walks the walk.
It's researches instead. Marcus, every week after we have so much fun, we then deal with some very serious issues, and today is none like other.
Yeah, exactly. And October, as many Barbadians would know, is Breast Cancer Awareness Month, and the Barbados Breast Screening Program does what it can to, just spread awareness and get people involved and to get people informed, etc. And right now we have the coordinator here. We have we have Dr. Shirley Jhagroo. And I did want to speak to you, Dr. Jhagroo, about everything that's going on this month and just about breast cancer in general. So good night.
Good night.
And thank you for coming.
Thank you for having me.
Yeah, this is something that I really wanted Bajans, especially within this demographic that are listening right now, to hear, because I can see a lot of people want to get involved. And something else that I realized too is, some people may have not as much information as others. So you're gonna talk about that today. But the Walk for the Cure this year was enormous.
Amazing.
It was a sea of pink.
My God.
How do you feel about that?
Oh, I'm so excited. I can't believe that it has happened.
Yeah.
When I saw the aerial shots of the pink man, it was a fantastic thing to see. And I must compliment you. You look lovely in your pink. Full pink earrings, everything. Nice.
Well, I have to set the example.
Yes,
right, exactly.
Yes.
and one thing for sure is even Barbadians, younger Barbadians, right, that don't really get very active and engaged in certain things. One thing they make sure to come to is the Walk for the Cure and Stand Up for Breast Cancer. Why do you think that is?
Well, you see, if you look at it this way, that every person in this island today would have been touched by somebody who's had breast cancer, be it a friend or somebody at work or family. So when it hits home, you can't help but have that feeling, I need to do something about this,
Mm.
And that the awareness has made a difference over the last 5 or 6 years, because people are coming, they're what we call self-referred to the clinic. They're coming themselves, they're not going to the doctors to check them or whatever. If they have a problem or they think they have a problem, they come straight to the clinic. And we have seen, I would say now, more than 50% of self-referred patients.
Really? So they detect something and then they want to come?
Or they're concerned about something.
Yeah.
And this is why you see breast self-examination is important. Because more than 85% of abnormalities are found by the women themselves. Or probably the partner passed the information on to them, something is not quite right there.
Is there a minimal age that a lady should be aware of that she should start doing this self-screenings?
Yes. Well, not minimal. We say that you should start in your late teens.
Teens, okay.
Like 16, 17.
Wow.
But we have had actually somebody 6 years ago who was age 18. And she was missed by several people. She was an adopted child. It was very interesting, an adopted child. But she went off to the States, and she's still alive, apparently.
Okay.
She did very well.
Nice.
But she'd gone to about 4 different people. But, when you know your body, it makes a difference.
Yeah. Something doesn't feel right.
I'm not comfortable with this thing.
Yeah.
And she was told by doctors, it can be cancer. So, but
maybe because of her age.
Yes. Eventually, she had it checked, and it was cancer, which shocked us all.
Yeah.
But we've seen people in their 20s and 30s. Breast cancer used to be considered postmenopausal women's disease.
Yeah.
When I was a medical student, you never saw people with breast cancer in age 40 and that. It was between the ages of 50 and 65. And that is still so, the maximum of patients I know. But we're seeing people now in their 40s and 30s and 20s. So this is why you have to be aware from early.
But saying that, I also remember you said that breast cancer is on the rise. In Barbados specifically, or you would say just in general?
No, it's a global thing.
So why though? That sounds strange.
I think one of the big things though is because people are more aware. So they're going to be checked.
Oh.
And the more people go to be checked, the higher would be the pickup rates. That's what has happened here. Say 10 years ago, there was still that stigma attached to breast cancer that even if people were diagnosed, they hid it. They didn't want and then there was this other myth that it was infectious. If
I mean, if you touch somebody,
contagious.
Also,
Really? Wow.
yeah.
Okay.
And that went on for quite a while. But though all those things, thank God, has gone. And it's due to the breast screening program and the awareness program. Because people know now that breast cancer is no respecter of persons. Okay? 2, because it can affect anyone. And because if you're diagnosed early, your life can be saved. So the idea that breast cancer is a death sentence is no longer there.
Right.
How often do you see persons come in and say like, they don't come in early, like it's very late along in the stages? Does that happen often?
Not often, no.
Not often.
That's why we started the program, because most of the people seen in, say, 2002 to 2004 were mainly stage 4 and 5, where it had already spread. So their prognosis was a 2 to 3 year survival.
Dr. Jhagroo, you mentioned earlier about, starting from as young as 16, but then how frequent would this be necessary to do these checks?
Yeah, but okay. What we suggest, we follow the American Cancer Society protocols.
Okay.
And it means that then therefore you start doing it late teens and you do it once a month. Even if you miss the odd month, that's fine. And the time to do it is just after your period. Because of hormonal changes, you'd feel things before the period, and when the period is gone, it's no longer there.
Right.
So we advise people to do it once a month. And then the other protocol is, there are 3 things. 1 is the breast self-examination. 2, to have your breast checked annually by a health personnel,
physician,
nurse,
right?
physician, whoever. And the 3rd thing is to start your mammogram screening from age 40.
Okay.
There isn't a hard and fast rule that must be 40.
Right.
If there's a family history or there's high risk or there's anything that concerns you, we can start earlier than that. The thing about that though is this: the younger you are, we have a big lecture coming off tomorrow night, and that's why I brought in these 2 experts, because the confusion in the island is this: well, why could I not just have an ultrasound? Why do I have to go to this machine and squeeze my breasts and so on? This sort of thing.
Right.
So these 2 experts, one will talk on mammograms and the other will talk on ultrasounds.
Okay.
Why we do mammograms and why we do ultrasounds.
Okay. Nice.
And the thing is, when you're young, your breast tissue is young, put it that way.
Okay.
And it's full of dense tissue. The mammogram they're not 100%. Actually, no machine is 100%.
Okay.
But the mammogram might not be able to show up that area because the amount of radiation that's passing through the modern equipment, like the one we have now, the digital mammogram.
Right.
The amount of radiation is less. So the breast tissue is dense, so it can't penetrate it.
Right.
Okay.
Now people always say, why you have to squeeze my breast and so on. So if you don't compress it with the mammogram leaves, then the radiation can't pass through.
Okay.
So that's why we don't do mammograms or rely on it on young people, because you might not see anything. And then we would follow up with an ultrasound. So this is why we use ultrasound.
Okay.
Apart from the feeling the physical lump, are there symptoms that one may experience that may be a cause for concern?
Yes, but we don't even want to see the symptoms.
Okay.
The whole idea now is to detect the breast cancer
Before.
Okay.
Okay.
And with some patients with mammograms, you see it, and you can't feel anything.
Right.
See? And
Okay.
we have now got new technology where you can see it on the mammogram, you can't feel it, and how are you going to biopsy those people? So we use this technology to put a guide wire in the area that you see on the mammogram
Okay.
and biopsy that. That's the machine that cost us $1.3 million. And that's where all the money goes.
Well,
Yeah,
it makes
right.
sense. It makes sense.
But that is something that I saw, because I honestly scan the social media all the time. I'm always on social media.
A lot of people are like,
all
where's
the
the money
people are
going?
asking, where is this money going? Like
Good.
it is some conspiracy theory to collect money, and like
Well, that's where it went. Nobody gave us money. It was the people of Barbados, the walk, and, the corporate Barbados that gave us that money.
and
We don't get any help from government, This is an NGO,
Hmm.
and we started with nothing. And we bought our first mammogram machine in 2002, and that's now they're extinct.
Yeah.
And then we bought that was called an analog, and then we moved up to the direct digital. That's the only one on the island. Mm-hmm. And now we have our eye on 3D, which is the tomosynthesis machine. And I'm hoping between this year and next year, if we raise enough money and we have enough room, we'll be able to move up to that.
Okay, great. Well, I wanted to talk about some other misconceptions that I saw on the social media. People were saying that, there's a big focus on breast cancer awareness and getting your breast checked, but if women had a healthy diet, then breast cancer would not be a thing. I've seen that more than once. I
keep hearing this all the time, but if you look at the studies, if we knew what a healthy diet was that would prevent breast cancer,
we would be doing it. Yeah.
Right.
It's a logical thing.
Right.
So I don't sort of go that way, but I mean, I believe in being healthy. Mm-hmm. Eat sensibly, follow the right protocols and do your exercises and things like that. But we do know something about breast cancer and obesity. They're linked. Mm. You see, but we do see slim people. And people do all exercise and do all these things, and they still have breast cancer.
Right. But if you stay healthy and exercise a lot, you think that would reduce the chances of it happening?
Not at
or if you're obese, you're at a higher risk.
At a higher risk. Okay. Mm-hmm. There are other risk factors. One is, of course, being a woman. That's number one. Mm-hmm. But men get breast cancer too, and that's less than 1%.
I've heard about that. Yeah.
And you've seen cases in Barbados that is.
Yes.
Just out of curiosity, I mean, a man may not necessarily have a breast to put in a mammogram machine. So how would a man get tested for that?
We do have a way of putting it in the machine.
Okay. Marcus, you want to go for a demonstration?
My breast will go in the machine? I don't think so.
Yeah, you can. Yeah, you can. You can if you have to. But then we also use ultrasounds, and that will tell you if what is there
if it's malignant,
solid, or if it's fluid.
Mm-hmm. How does it show up?
The ultrasound will help to identify whether this thing that you're looking at has solid things in it, or if it's fluid.
Like when I YouTube that?
Yeah, I want to see. Can you see it visibly? Like, can you see like a lump for men?
Yeah, but you can feel it. With men, it's easy to feel. It might feel like a pea, like a split pea. Mm-hmm. It can feel like anything
like
big,
chewing gum,
a downs, anything like that.
Now we're here checking, boy. Jeez,
This is why men should also, check. And look in the mirror, and it's easier for men to see these things. But why do men die from breast cancer? Or why their prognosis is so bad? Because a typical male, they do not go if they see something abnormal. Mm-hmm. If they see something different, they won't go, that's nothing. Mm-hmm. I probably hit it. Things like that.
Yeah, right.
So by the time they go, it's kind of late, yes.
So then how would we know, when to go? Should we just, do it, just for safe measure, just to go, even though we don't see anything?
Check your breast. You pass your hands on it and,
okay.
And if you feel
check them yourself, Marcus.
Yeah, check them myself. Yes. I shouldn't ask
you can ask your partner to check your breast.
Oh, no problem.
Oh, you can ask your partner, yeah.
That's not a bad idea. That doesn't talk about it at all.
Sounds good.
No, but you see, a lot of women with breast abnormalities are found by their partners who would point it out to them, something's not right in that breast. I can feel something there that I wasn't feeling a couple of months ago.
Oh, okay.
So you see, this is the thing about women and doing the breast self-examination. If you know your body, if you know your breast, and you will eventually, if you're doing it regularly, and something new turns up, they pick it up.
Mm-hmm. Okay.
And if you're looking at your breast in the mirror and you're checking the way we teach you to do it, and you might see a puckering, you might see, something. Somebody might even see a little dimple that would suggest that there's something going on under there.
Mm-hmm. Okay. Another thing that I saw that I guess black women have a higher chance of getting breast cancer.
Well, in Bermuda, yes, they found that, and in the United States. But I tell you what's happening in the United States is that people don't go. The average black woman does not go for screening the way the others would go. Mm. It's a cost one, and they don't have the insurance. Things like that causes the problem of a bad prognosis, because by the time they go, it's late.
So that being said, basically everyone is predisposed
That's what I said. It's no respecter of persons.
Right.
Yeah.
But of course, women are the number one at risk.
Right.
Mm-hmm.
And when you're over age
50
to
okay.
65, there's a peak. And then after 65, it tends to fall off.
Okay.
But all women are at risk,
Mm.
young and old. That's what we're saying. Obesity is another factor. And then there's another factor where if there's a family history.
Mm-hmm.
But then that's only 2 to 8%.
Right.
So we have to explain the other 92 to, 95% of people who get breast cancer.
Right.
Then if you have already had breast cancer, you're still at risk.
Yes.
You know. Then, for instance, there's a thing, ovarian cancer of the ovary,
Mm-hmm.
which is sometimes hard to diagnose.
Mm-hmm.
Now, if you have cancer of the ovary, you're at risk of cancer of the breast.
Okay.
And if you, this is, I find very interesting, but studies have shown that if you have your first child over the age of 30, it increases your risk.
Oh, wow.
Wow.
If you menopause late,
Mm.
if you menopause over the age of 52,
Mm-hmm.
your risk is
Is
increased.
Wow.
That tells us, therefore, there's a hormonal thing going
Yeah,
on.
yeah.
You see?
Mm-hmm.
So if you start early, if you finish late, you're at a higher risk.
Mm-hmm.
But obesity is definitely one of the factors. And of course, nicotine, people smoke.
Mm-hmm.
Oh,
If
yeah.
you live in an environment where people smoke,
Yeah.
nicotine is associated with most of the cancers,
Yes.
but also with breast.
My final question that I saw, this is stemming from something I saw online, that people said that a lot of attention is on breast cancer, but not ovarian cancer, and they think that it should be just as much. What would you say to that?
Well, no, I would not agree with it totally, because the incidence of ovarian cancer, there's nothing compared to breast cancer.
Yeah, because breast cancer is how much? What's the statistic? It's 1 in 8? One in every
1 in
8?
7, 1 in 8.
Yeah.
Ovarian cancer is not like that. The thing about ovarian cancer is difficult to diagnose most of the time.
Yeah.
Yeah.
You know,
Mhm.
because you might have nothing, see nothing, and then just feel bloating or discomfort or some irregularity with your period. And this is why, in actual fact, I keep saying to postmenopausal women or women who've had a hysterectomy or whatever, you still have to go for your gynecological check every year. Women, even if you're in your 70s, go for your check every year. You might not have to do a pap smear, but have a gynecologist, because the key to this is an internal examination. And if the clinician finds an ovary that's enlarged, right away, that puts you onto your guard. You see, and that's the thing. I keep saying to them, go and have your check, even though you're not having sex, or even though you're 60 or whatever. That checkup is important.
Yes.
Because that's how you're going to diagnose it. And if the doctor is suspicious that this ovary should have shrunken up and disappeared, I shouldn't feel it, which is my little clue. When I do a woman over 50, I don't want to feel her ovaries really.
Yeah.
I want to mentally think, well, if they're shriveled and gone. And if I do palpate it, I would say, we need to do an ultrasound on this. And let me just look for your ovaries and make sure it's all right.
Yeah.
Okay.
So that I would not agree with.
Okay.
Ovarian cancer, breast cancer, the two are just...
Yeah.
What's happening in Barbados, though, we find now the endometrial cancer is increasing. That's the cancer of the lining of the womb.
Yeah.
Oh,
And we're
okay.
seeing it more in the postmenopausal women. So those women have to, particularly if they're diabetics. And we have a lot of diabetic women on the island. These things are all linked up, so
Yeah.
we have to keep an eye on those.
Okay. What is one thing that you would want to tell all of our listeners right now? Something to sleep on, something to go away with?
Well, you need to know your body. That's number one. And in order to do it, you have to monitor it and check on it. And breast cancer is taking the lives, it takes the lives of the majority of women in this island that is diagnosed with cancer. So we want you to be aware and make sure that even if it is diagnosed, because we still don't know the cause, that it's diagnosed early. Because if it's diagnosed early, you have a life,
Yeah.
which is like any woman who has not had cancer. If we can find a woman stage 0 to 1, we have 99 to 100% rate of
Survival,
5
yeah.
survival, 5 years survival.
Okay.
But what I want, the little thing I want to plug tonight is this, that lecture tomorrow night. It's very important.
Okay.
People must understand why they're doing mammograms and why they're doing ultrasound.
Is it open to everyone? Or?
Yes, it's a free lecture.
You don't have to register
public,
or anything?
No,
Okay.
it's free and it's public.
Oh, great.
And it's at 7 o'clock at Lord
Erskine
Sandford.
It's a mouthful.
And these two are experts. One is expert, he's coming from Mona, and the other one is from Trinidad. And they're Caribbean trained doctors, but both specialists, one mammogram and the other one in ultrasound.
Okay.
So they can't get better than that. And it's to reinforce the importance of doing these things and why they're doing it.
Mm-hmm. Dr. Jhagroo, we can't thank you enough.
Just before we go, if someone listening wants to reach out to the Cancer Society and the Breast Cancer Awareness Initiative, how can they do that?
Very easy. Just call us. We're ready to welcome anyone there. And we're always looking for volunteers, particularly in September and October, to help us with the telling of sheet shirts and doing the pink ribbon and things like that.
Okay.
Because all that helps with awareness, but that's the only fundraising we do all year.
Okay.
Right.
Yeah.
And that's how we buy all these equipment. We want to I'm one of these people. I have to stay on top of whatever is happening. You know what I mean? When it comes to equipment wise, I something think, God, you're a freak. Why you want to get this from what? See, I go to conferences and I see these things.
Right.
And we can do
how
this.
effective and efficient they operate and work.
Why
Yeah.
could we not just do it? You know what I mean? When we started this program, we had nothing.
Right.
And people, you could buy that machine. I said, give us time, we'll get it. And in 2 years, we've never borrowed money. We've always bought everything cash. And we have the best mammo machine in the island, the best ultrasound machine in the island. And we've got the experts to use it. This doctor that's coming to speak, one of them, he comes in once a month from Trinidad. It's been doing that for the last 3 years.
Okay.
To do the
Nice.
ultrasound and do biopsies using the ultrasound.
Okay.
And we've now trained somebody locally who's helping out in that. And then with the mammogram, we've got the best machine and we used a local radiologist to read it. But those things really help with the early diagnosis, and that's the way to go. Because that's universal. That's what everybody's doing.
Yeah.
Okay?
Dr. Jhagroo?
Until such time that we know the cause of cancer, breast cancer, and it's no longer there, and there's a cure.
Mm-hmm.
Until such time, early diagnosis is still the way to go.
Okay.
Thank you so much for coming.
Thank
you.
Thank you. What the breast screening program does, I really was paying attention more than ever this year. Not to mention, I'm getting older. All my friends are getting older, and we need to be aware of these things. And what you're doing, there's no price that I could put on that. And I just want to say thank you so much. And keep going, keep saving lives, and we're all going to play our part.
Good, great. That's what I want to hear.
Great.
Because if we all play our part, it makes life a lot easier.
Mm-hmm.